Professor Breitschwerdt, welcome back to the Tick Bootcamp podcast.
Thank you. Appreciate being here.
I always have to apologize if you're butchering your name, so I do apologize in advance. And so let's go through your background very quickly. Folks who want to learn more about you can listen to the long form podcast we did with you, which was about 2 hours long. And thank you for taking the time to do that. But please just share with folks what you're doing at NC State as a professor, and then, of course, at Galaxy Lab.
Gotcha. So I'm a by training veterinary internist. Did a internship, medical residency at the University of Missouri, and then was on the faculty at Louisiana State University for about 6 years. And then went to NC State, where I've been for a very long time. And I'm also an adjunct professor in the Division of Infectious Disease at Duke. And we collaborate with Duke, we collaborate with UNC. And the focus of our research has essentially been to look at what ticks, fleas, and other vectors might be transmitting to animals and humans, particularly in the southeastern United States, Rich, because as you well know, Lyme disease is predominantly in that northeastern, north central, and so somebody had to figure out what was going on in the south.
So talk to us about your private lab and the work that you do at your private lab as well.
So we were just talking about the fact that both of us have a child who is a lawyer or about to become a lawyer.
Yes.
My son was at UNC in law school when he was taking a business course, and he called me up and said, "Dad, can we use your patented media that you developed at NC State to put a business plan around?" And I said, "Help yourself, son, because nobody else seems to be interested in it. I've talked to people in veterinary medicine, human medicine, and pharma, and we had already done enough work to show that it had promise. It showed that it could grow these organisms up to a level that we could document the infections on a DNA basis. And that was really the origin of Galaxy Diagnostics. As a result of this course, there's what's called the Carolina Challenge, and he and his buddy, who was a MBA student, would present, and I'd drive over at the end of the day on Monday evenings, and ultimately one of the coaches said, "You guys ought to think about a small business." And, I had co-directed a diagnostic laboratory for veterinary medicine for about 25 or 30 years. So I knew the diagnostic business on the veterinary side. The human side is a whole lot different.
Yes. So one of the things that our community really responded to when we had the long form podcast with you is that you brought another perspective to this analysis, because of course an illness such as Lyme disease is an illness that transmits from an animal to a human, and there is a vector that is in between. And you give us a very important and I think dense understanding of that, the first part of the process that most of us don't spend enough time focusing on. So can you talk to us a little bit more about the work that you've done with animals and understanding how these microbes ultimately make their way into the human population, and why that's so bad for us to, and why it's so difficult for our immune system to fight off those diseases?
Yeah, I think clearly starting, there's books on zoonotic diseases that go back 50, 80 years. But I think the realization that when we look at new diseases that are being discovered, that there is a reservoir in the animal that ultimately that organism makes the jump into a human. And, as a veterinarian and a veterinary internist that deals with a lot of animals with chronic disease, one, I need to understand those organisms in my patients, but I also have to be very concerned about if they establish a infection in my patients, how often can that actually make the jump into a human? And so that's where the term zoonoses, where the animal's a reservoir and it goes into the human, is really important. The other thing, especially with our Bartonella research, that's been very, very valuable is I can look at the human literature and see what's being published on people that have documented Bartonella infections and look in our animal patients. And then we've used the dog as kind of a naturally occurring model to say to physicians, you guys should be looking at this in your patients because we're finding it in the dog, and the dog behaves so similar to a human in regard to the immunologic response to these infections.
So let's talk about the two areas that I think our community is most excited about when we interview you and we talk about you. And we
Sure.
do quote you often, by the way, so your ears are probably ringing, of course. And we do not define Lyme disease as a disease that's caused by one strain of one bacteria. We define it as a polymicrobial infection. And two of the infections that are, I think, the most difficult for our community to deal with are Bartonella and Babesia. And the BART piece is because of the mental health challenges that are often associated with Bartonella. Folks are very, very anxious about Bartonella, BART testing, BART treatment, and of course we understand that Babesia is another challenge that has to be treated very differently than these bacterial infections. So you can talk to us about the work that you're doing on those two particular microbes, or I guess a microbe and a parasite, and how you think the work that you're doing is going to be helpful to people in the Lyme community.
So I really appreciate that question because, number one, I never had this in my 5-year plan for the university where we have to write out our 5-year plan. And I'm absolutely amazed at what we've been able to accomplish in a relatively short period of time. And what I mean by that is we have now clearly put on the map that a chronic intravascular infection with Bartonella or a chronic erythrocytic infection with Babesia can be documented on a molecular basis. So essentially that going to the crime scene and finding DNA and saying that at least you found DNA of the perpetrator at the crime scene. We've been able to do that both with Babesia and both with Bartonella, and thanks to Dr. Ricardo Maggi, who's the research microbiologist in our group, we can do it better, I think, than anybody in the world at this point in time. That doesn't mean somebody might be doing it better than us in the future, and hopefully that's the case, because, the most important thing in diagnostically is sensitivity. If a patient's infected, we need to be able to prove that that infection exists. And then the second thing that's obviously important is specificity, that we're not finding things that really are wrong and reporting them out as a diagnostic finding. For, again, me as a veterinary internist, having an institutional review board study that started with my colleagues at Duke, the fact that we've got two genera, and we already knew that Lyme and neuropsychiatric illness was a big problem. Robert Bransfield and others have done an amazing job at trying to get that documented into the literature. The problem with the Borrelia is it's harder to find the DNA of the organism in the blood. It's still hard for Bartonella, it's still hard for Babesia, but we can do it much, much more often. And so, I think what my lab has contributed that's really going to help every Lyme disease patient that has a polymicrobial infection and help validate what ILADS doctors have been saying for literally decades is there are people infected with just Borrelia burgdorferi, with just Babesia, with 2 of the 3 or 3 of the 3. And, in our data, we've got proof of all of those.
I can share with you that in the 500 or so patients that we've interviewed in the long-form podcast, very rarely will someone test for a single microbe. In most cases, the big 3 are the 3 you just outlined, and I would venture to guess, and I think we could ultimately determine it. Almost all of the people we've interviewed who are chronically ill do have all 3 in their diagnostic history. Can you talk to us a little bit more about the Bartonella? Because that's really what people get most excited about when we talk about you, and the different ways that Bartonella can make it from the animal to the human host.
So that's a great question, and it probably varies with each of the Bartonella species somewhat. The best data that we have, both for humans and animals and transmission, is Bartonella henselae or the flea-associated Bartonellas. And I really have emphasized, as I've looked at the literature and our research, the fact that we need to be as concerned about fleas as we are about ticks. Fleas, the common cat flea, so everyone calls it the cat flea, but it's the same flea that gets on dogs about 98%. It also gets on coyotes, it gets on possums, it gets on other animals that are out there in the environment that literally, like we've said with ticks being in our backyard, these animals are going through our backyard,
Yes.
and those fleas want blood, and if they drop off and they lay eggs and they hatch out, and your dog or cat goes into that backyard, they're going to be exposed and they're going to become infested and they're going to become potentially. But your specific question was, okay, how does it get from the animal to the human? And what we clearly know in regard to Bartonella henselae, Bartonella cholerae, Bartonella cleridiae, three of the most important Bartonellas that are transmitted by the fleas. There may be another three that are being transmitted, but that hasn't been proven in the laboratory studies, is the fact that once a flea takes a blood meal from an infected animal, so say you went to the rescue center and you rescued a young cat and you didn't know it, nor did the cat know it because the cat wasn't clinical, but you brought it home and it has Bartonella. And then by some mechanism, a flea infestation ends up in the house. Once that flea takes a blood meal, within 24 hours, there is Bartonella in the feces. That Bartonella persists in the feces for the life of the flea based on laboratory studies from at least 2 or 3 different laboratories now that have looked at this. So in the laboratory, that's about 14 days that you can actually take flea feces and grow up Bartonella. And then what is clearly the primary way of transmission is when that cat grooms itself and it contaminates the nails or it contaminates the saliva, and either through a bite or through a scratch, the Bartonella is then transmitted to the human. But what's really being transmitted is Bartonella that's been contaminated in flea feces.
So cat scratch fever is it's flea poop and Bartonella.
It is, absolutely. And you know, the major concern, and the longer we do this, so my lab, other labs around the world have PCR Bartonella DNA out of saliva. And the question is there enough viable Bartonella in a cat's saliva to transmit if they don't have a flea? So if the cat's bacteremic, and we've followed cats belonging to our veterinary students way back several decades ago,
okay,
that were bacteremic for 3 years while they were in veterinary school. You know, we would bring them in, we culture them periodically. And this is where, when we talk about zoonoses and we talk about a reservoir, you know, on an evolutionary basis, cats have evolved so effectively with fleas and with Bartonella that they can remain asymptomatic with that infection for years, which is a big problem, obviously. If you have a cat that has been bacteremic for 2 years, never had a flea infestation, and all of a sudden, you know, you bring in another cat that has fleas, and that cat may not even have Bartonella, then you've got a situation where those fleas are taking a blood meal from a Bartonella bacteremic cat.
So now with patients who are harboring the big three,
Yep.
Let's talk about the Bartonella piece of it. Do you think it's likely that the Bartonella was ultimately injected into them from a tick bite, or do you think it's a multiple insults, including either flea bites or cat scratch?
I think it's likely that there's both, but I think it's more likely that it's infections occurring at different points in time,
Okay,
rather than a tick that is actually transmitting. And again, there is reasonably strong epidemiological evidence and some clinical evidence from both human medicine and veterinary medicine with us with dogs that ticks seem to be transmitting Bartonella, including Bartonella henselae. Unfortunately, proving that in laboratory studies has been very difficult. And both my lab and Dr. Ember's lab at Tulane University, we still have some work that we haven't published yet, and we're still trying to sort things out a bit. But I think there's been a recent publications out of CDC where they've screened Oxodes scapularis ticks in the United States, and unlike what's been reported from Europe, very few of those ticks have Bartonella DNA in them. However, we looked at a different tick from the southeastern United States that's Oxodes affinis. It's a cousin of Oxodes scapularis, the Lyme disease tick, and that tick had plenty of Bartonella in it. So, you know, part of it may be which tick.
Or species-driven, right? And we have the same thing with Lyme, right?
Absolutely.
I mean, with Borrelia, we have the Lone Star tick where I live on Long Island, and we're more concerned about the alpha gal when we get bitten by
Absolutely.
And actually a recent tick bite that I had with a Lone Star tick, it had anaplasma and Ehrlichia, but no Borrelia. So I mean, obviously it's going to be species-driven in some way. But one of the reasons why I love interviewing you is it's always helping me to learn more about how to define this disease, right? And we've moved away from defining Lyme disease as one bacteria, but now I think with the information you're now giving me and the education you're giving the folks who are viewing this now is that it actually is also going to be polyvector, right? I mean, I think the people who are chronically ill probably have polyvectorial and polymicrobial infections.
Amazingly enough, I think immunologically, and again, our immune system's been evolving from a very, very long time.
Millions of years.
Yep, and it's that evolution and the sophistication of the immune system. I joke with my internal medicine residents that when I graduated from vet school, it was really easy because we had one lymphocyte. Right. Now, we've got B-cell lymphocytes, T-cell lymphocytes, suppressor cell lymphocytes, killer cell lymphocytes. We know that, you can look at the lymphocyte, it all looks the same, but there are different lymphocytes doing different functions. Right. And that's just one immune cell in our body. We've got so many overlapping. So I think, what Lyme literate doctors are seeing, polymicrobial infections are really important, whether they occurred at one time or sequentially over the lifetime of the patient. But I also think that it's critically important, if we're talking science, that we talk about each of these individually and not make Bartonella a co-infection of Lyme.
I agree.
Because obviously you can be in an area where you could have never been exposed to Borrelia burgdorferi. You can have a cat that has fleas, and you can get Bartonella henselae and be chronically infected.
Yeah, but I also think it's really important from a prevention standpoint, right? Because if we are going to continue to have companion animals, and we will,
absolutely,
right?
And we should.
We co-evolved with them, and because we co-evolved with them, and they do enhance our lives, we have to make sure that we're not only protecting ourselves when we go into the world, and make sure that we are not coming in contact with ticks or taking steps to make sure we don't come in contact with ticks. And not only do we have to make sure that we're protecting our companion animals so that they're not bringing ticks in, but it's just as important, maybe even more important based on what we're talking about now, to make sure that we're also protecting against fleas. That we
absolutely
have to be really aggressive about making sure
I think that is such an important message, because that particular flea has a worldwide distribution. It does not have a very local distribution. It literally, North America, South America, Asia, Europe, it has a worldwide distribution.
And I think there's certainly the sense in the Lyme community, I think we may have talked about this offline, that the Bartonella, at least the mental health elements of Bartonella are so severe that we need to pay more attention to that microbe in particular, both from a diagnostic and from a treatment standpoint, because there may be many people who are in a very bad place emotionally, and that could be treatable if the proper diagnostic and treatment tools are in place.
And I think it's important to emphasize the fact that the neurologists, the psychiatrists have, in the last decade, increasingly documented that patients with psychiatric disease have an increase in inflammatory mediators, whether we're looking at cytokines or we're looking at C-reactive protein or SED rates or other things. Again, one of my biases as an internist is, okay, that's great, they have increase in inflammation. What is causing the increase in inflammation? Can we define it? Can we definitively define it? And can we make it go away? And if we do, does the patient get better? And that's where, I went to my 5-year plan, but the fact that we've been able to put in the literature now 2 other genera that psychiatrists should be considering, in addition to Borrelia, is amazingly, to me, important. And, again, having dealt with families where a single member had neuropsychiatric illness, was homicidal, was suicidal, that didn't just affect that individual, that affected that family. It literally turned it upside down. They got rid of their animals. The mother sleeps with one son, the father sleeps with the other son. This goes on for months and months and months. Some of the people that have been in that situation have ended up divorced. It's in addition to, the financial hardship, the emotional hardship for the individual that's experiencing the neuropsychiatric illness is atrocious, but for the family, it's equally difficult. And, again, I really hope that what we've identified is the tip of an iceberg. I really hope that certainly the Cohen Foundation has supported us, and it's been that support that's allowed
awesome, yeah.
us. It's also, you mentioned Galaxy Diagnostics, and that is a primary focus and primary goal for Galaxy Diagnostics is develop tests that are specific enough to say whether a child with neuropsychiatric illness has that organism in their blood. And if the answer to that is yes, then a physician has at least a target that they can go after.
Well, thank you for all the great work you're doing, and congratulations on the contributions you've made. Thank you for the contributions you've made, and I'm really excited to make sure that we stay in touch with one another so that you can continue to share with us all the great developments that you are personally engaging in, and the folks that you're employed at your lab are engaging in.
Thank you, Rich.
Thank you.
Appreciate it.
It's great seeing you.
Thank you, sir.